Hello, my name is Dr. Mercedes Malone, and I am an internal medicine resident at HCA Florida, North Florida Hospital. Dr. Okonobo Peters is my attending, and he assisted with the creation of this poster entitled as An Atypical Presentation of Cerebral Venous Sinus Thrombosis, typically abbreviated as CVST. We hope that our poster sheds awareness of this condition and allows for identification in cases where a young patient presents with stroke-like symptoms into the emergency department. Let us begin with the case presentation. We had a 19-year-old female with a past medical history of mood disorder and menorrhagia, presented to our hospital after she was discovered to be unresponsive by her family. She was in normal health prior to coming to our hospital. However, the family did notice that she was slightly more fatigued than usual. Physical examination in the hospital did not show any sign of traumatic injury or visible signs of the motor vehicle accident. She was unresponsive to both verbal and painful stimulation. She started to experience seizures and was intubated for airway protection. When we performed laboratory workup in the hospital, there was finding of hemoglobin of 4.8 upon admission. The microcytic anemia was correlated with her menorrhagia, and a pelvic ultrasound substantiated this finding of endometrium thickness, and therefore correlated the anemia with her history of heavy menstruation. A non-contrast CT scan of her brain was performed initially, and it showed a subarachnoid hemorrhage with bilateral cortical petechial hemorrhage. There was no finding to explain the underlying etiology. It was not clear why she had a subarachnoid hemorrhage. She was young, there was no sign of visible trauma such as motor vehicle accident, there was no substance use, and a drug urine test was also negative. There was no history of hypercoagulable disorders or brain aneurysms in her or her family, so there was no explainable reason why this happened. Given that there was a high clinical suspicion for CVST, an MRV or magnetic resonance venograph was completed, and it showed thrombosis of her superior sagittal sinus. The image is in the center of our poster, and the pink arrow points to the area of thrombosis. Underneath the MRV is a graphic representation of where the sinuses are located. The cerebral sinus are a vasculature that is responsible for draining the venous blood from the brain after oxygen and nutrients have been extracted from the blood. And a clot in the cerebral venous vasculature is very rare and occurs in 0.003% of adults. However, it is very important to consider this condition, especially in cases of young female patients that come in with a stroke. And one must have a high clinical suspicion of this condition in these situations. The patient underwent a thrombectomy, and she attained intravenous thrombolytic therapy. This is one case where it is acceptable to provide thrombolytic therapy despite the finding of subarachnoid hemorrhage. Thrombolytics aren't contraindicated in the case of CVST when there is a clot in the venous vasculature. Ultimately, our patient recovered well, and she was discharged home with an oral anticoagulant. It was discovered that the patient had been on oral contraceptive pills, and the decision was made to discontinue the oral contraceptive pills. Oral contraceptive pills and her iron deficiency were risk factors for her to form a clot in the cerebral venous vasculature. Another risk factor that she had was her female biological sex. These predisposed her to having a clot in her venous vasculature. It is important to consider this condition, especially in the case where a patient presents with subarachnoid hemorrhage, as this diagnosis can obscure the underlying mechanism for the presentation, and one must have a high clinical suspicion of CVST. The case we present, we hope that our case that we present sheds light on this important finding. Thank you.